the federal government has rejected Utah's partial Medicaid expansion. It actually was a preemptive rejection, and we'll talk about that in just a moment. Let's get back up to speed of what has been happening in Utah over the last year. First, there was a state law signed by Utah's Governor Hebert last March. It included partial Medicaid expansion up to 100% of the federal poverty level. That included strict work requirements, and that needed federal approval before it could be implemented. So it went to the Centers for Medicare and Medicaid Services, part of the U.S. Department of Health and Human Services, and they sat on it. And they actually said, we're not going to be approving any of these waivers until we get through this midterm election that's going on. They didn't want any political ramification to its decisions. So they did nothing. In the meantime, Utah did something that almost no other state has even attempted to do, and that was to put Medicaid expansion on the ballot in their midterm election as a referendum. And the people of Utah voted for full Medicaid expansion, not partial expansion and not work requirements, full Medicaid expansion. So then let's pick back up in our timeline. The governor and legislature overruled that ballot measure that had been passed in that November election and instead said, we're going to move forward with this Medicaid partial expansion plan with work requirements, and we're going to make sure that the feds approve it this time. So they sent a proposal to CMS, and with a 70% federal participation, 30% state participation, covering adults up to 100% of the federal poverty level. Covers fewer people, costs more, and the Fed said that they would definitely take a look at that. It was then approved by the federal government. And then Utah said, you know what? We don't want to pay that much for that plan. So they started drafting a new waiver for partial Medicaid expansion that said, no, feds, we want you to pay 90%, not 70%, 90%. We want to pay 10%. And even though most states that do Medicaid expansion expand up to 138% of the federal poverty level, we only want to stick to 100% of the federal poverty level. And that was rejected by the Centers for Medicare and Medicaid Services. It was a preemptive rejection. They didn't actually have the waiver in hand. They issued a statement that said, we will not support enhanced funding for partial expansions. So Utah is now back to where they were before. It is now back to the legislature and governor to decide if they want to keep moving forward with the former approval of CMS and, again, completely rejecting the referendum that the people of Utah voted for. CMS and its rationale for why it would no longer support partial expansions, enhanced funding for partial expansions, was, and this is the quote, unfortunately, this would invite continued reliance on a broken and unsustainable Obamacare system. So this was a pretty stark, politically charged statement coming out of CMS. Advocates were actually cheering the fact that this partial expansion was rejected, but did add the footnote, it was rejected for the wrong reasons. It should be rejected because Utah should have done what the voters asked for and do a full Medicaid expansion with 90% federal participation and 10% of the state paying for it. But at least it was rejected, so it's a small win for advocates. It's left to be decided how CMS will continue to evaluate work requirements in the light of what other states have had ended up in lawsuits. So we could actually see some litigation in the state of Utah should a couple of citizens come forward to challenge what should have been passed by referendum, but instead is a lot more restrictive. You can actually read that letter, that preemptive rejection coming out of CMS. We linked to that in the description below. If you like the content you see here, you can hit that like button and go ahead and subscribe.